chondrosarcoma. Chondrosarcoma is a malignant primary bone tumor. It's derived from its name chondro. It arises from cartilage forming cells. Cartilage forming cells which are called chondroblast. Therefore, this tumor arises from the chondroblast and characterized by cartilage formation. Chondrosarcoma as incidence is the third common primary malignant bone tumor. The commonest bone tumor is multiple myeloma. The second common is osteosarcoma. The third common is chondrosarcoma, and usually occur in adult life between 40 to 60 years. Pathologically, the tumor usually arises from the pelvis, especially hip bone, especially iliac bone, or scapula, or from the epiphysis of long bone. Epiphysis of long bone as usual around the knee, epiphysis of lower part of femur or upper part of tibia, or upper humerus. Chondrosarcoma may arise de novo in normal bone, but we take in benign tumors that chondrosarcoma may complicate chondroma and osteochondroma. Therefore, chondrosarcoma may de novo, which means in normal bone or on top of already present benign tumor like chondroma or osteochondroma. Complications as usual as we take before in any malignant tumor. Spread, direct spread to the surrounding structure. Blood spread is late to the lung, and the lymphatic spread is very, very rare. As we said before, lymphatic spread is very, very rare in any sarcoma except Ewing sarcoma. The tumor erodes the bone, therefore the bone becomes very thin and very weak, leading to pathological fracture as complication. What is the clinical picture? The clinical picture, there may be history of the cause, history of swelling in area of the body like chondroma or osteochondroma. The swelling in this tumor, large, rapidly growing, painful, hard, fixed in the characteristic site, like the hip region arising from the ilium, or the scapular region arising from the scapula, or the epiphyseal region in the long bone. Investigations, the routine investigation for all bone tumors, plus X-ray. What is the characteristic finding in plain X-ray? The characteristic finding in X-ray is lytic lesion, bone destruction, with intra-lesional calcification inside the tumor. The calcification may appear as a ring, like this ring, or arc, like this arc, or popcorn calcification. All these intralesional calcification give this calcification the feature of fluffy cotton, appearance. In plain X-ray and in CT scan and MRI appear industrial scalloping. If the tumor here, this is the normal bone and this is the normal cortex, at the region of the tumor erodes the endosteum and erodes the cortex. We said in chondroma, if this endosteal scalloping and erosion less than 2/3 of the cortex, it is a benign tumor and chondroma. But it is very clear here that endosteal scalloping is more than 2/3 of the cortex, which means malignancy endochondrosarcoma. And also here there is thinning and erosion of the inner aspect of the cortex, more than 2/3 of the cortex, which means chondrosarcoma. What is the treatment of this condition? The tumor is resistant to chemotherapy and radiotherapy. The only treatment for this tumor is surgical, radical resection or amputation. This is the chondrosarcoma. Thank you for good listening and good luck.